So let's just wait for people to join before we start this webinar or this live. So this is my first YouTube live, and let's see. Cool. Hi. Hmm. Am I visible? No. Oh, okay. Cool. So now I think I'm visible. Oh, just my DP? Okay. What about now? Am I visible or not? Some are saying no. Just hit a like button if you can see me, and thumbs down in the comments if you can't. So, am I visible? Cool, wonderful. So I can read your comments as well, and I think we can start the live now. I have written down some questions. Okay, so there are. Hmm. I think people are not able to. Still, some people are having trouble. I think there is. Give me just 2 minutes, guys. Your patience is something I need right now, because there are so many people who have joined on the from the laptop, I think, and they are not able to see me. And without looking at me, understanding this whole process will be a bit difficult. So let's just give them 2 more minutes and see if they can join in directly. Hello, Harshil. Okay, so I'm gonna keep my laptop and my phone both on. Okay. Uh, Is Nidhi and Samir here? Are they in the live? Okay, so let's just let's just talk about the topics that I wanted to discuss in this live. You guys can ask your question. Uh, Let me see. So, kharcha. Okay, so the total expense of AMC is around 8 to 10 lakhs. It can vary because they have recently reduced the price of AMC exams. So if we are talking about total expense, I have posted a complete video about from zero to the day you come to Australia, how expensive it is in exact numbers. So watch that video, but overall it's around 10 lakh rupees. Okay, if you guys are here on laptop, then just comment hello, hello. uh NEET PG and AMC course are similar or different? I didn't get your question. And NEET PG is for India, AMC is for Australia, and AMC is way better in terms of passing percentage and getting your dream branch. So I would recommend AMC. And somebody asked about confusion between Australia and New Zealand. So both these countries are like siblings, but Australia is like paying more, the workload is less, so many New Zealander doctors are coming to Australia. The only people who live there, they stay there, but they come on and off to Australia to earn more and then go back to their home country. So okay, Sahil has asked about the online resources. So there are some resources that you can use. There are so many question banks. There is Amadex, M plus X, and recently AMC has recommended eMedici. We are not sure how many questions they're gonna from eMedici app. So these are the question banks. Rest you can prepare from John Motak, Redbook, questions from Blue Book, RACGP guidelines, up to date, ETG. There are so many things. So if you want to prepare by yourself, you're gonna take 4 to 6 months at least. And I have posted a video how to prepare by yourself. So watch that and get the complete hold. But if you need our help, our managers Nidhi and Samir can tell you about our 3 month AMC preparation course that is starting this week. So if you are interested in preparing for AMC 1, you are at the right place and you don't have to go for anything extra if you are joining us. And in 3 months, the whole syllabus and the questions and everything will be all done, and then you can go for a self study of 1 to 2 months and take the exam and pass it in your first attempt. Okay. uh okay. uh, I think my link is not shared, or what's the situation? Okay. Cool. So Nidhi and Samir, if you are in the chat, can you please mention your number and I'll pin your comment in there so that people can contact you directly if they are interested in the AMC preparation course. And the total cost of this AMC course is 55,000 Indian rupees, and it is one of the cheapest and most useful resource you will find out. So don't hesitate to contact them. And there we are not just providing the classes and materials, it's live classes. Same class will be uploaded on the systems, you can watch later. Questions, mocks, mini mock exam, high yield classes, and everything that you need to know for this AMC preparation. So go for it. Course price is 55K, I already told. So to sit into AMC exam, you don't need English exam, but when you're applying for jobs, you will need. So first you clear AMC 1 and then go for English exam. Okay, so if you guys can join the, okay, there are two lives going on right now. One is from my phone, one is from my laptop, so it's too confusing, but I'll try to read the comments. uh, so Jot has asked a very beautiful question. If I haven't studied during my first year, second year, am I gonna pass this exam? Definitely AMC 1 is the most clinical exam that you can pass. You just have to use your common sense and learn some guidelines of Australia, because you just have to go with the guidelines here. You don't have to know the pathophysiology and the details, latrum shatrum for this AMC exam. It's one of the simplest exam if you know how to pass it, the pattern and the strategy. So we are here to help you out. So if you have any doubts, we'll be there, don't worry. AMC2 is offline these days, so even I'm ready with my AMC2 course, but the only issue I'm right now solving out is I don't want to take the physical examination classes online, because face-to-face exam needs face-to-face teaching for physical examination. So soon we'll be coming with AMC2 exam and we'll teach you guys how to pass it, and the passing rate is not a problem for us, because that's just numbers. We don't treat numbers, so we have to pass AMC1 and AMC2, so don't worry. So somebody has asked about the specialist pathway. Yes, if you have specialist degree in India or any other country and you have some experience, and provided you are from the medical background, you can come on a specialist pathway. I have uploaded a complete video on specialist pathway if you want to watch, but I would just give you a heads up. If you have done MD medicine only and then you are not working as a consultant for more than 3 years, then there is no point of going for specialist pathway. Best is to clear AMC1, come here as a PHO, and then try your luck with the specialist assessment. And we as a DRG coaching, we are providing help with the specialist assessment OTP form in medical specialties like general medicine, cardiology, neurology, endocrinology, and so and so. But we don't provide much assistance in surgical branches yet, but we'll do it soon. Okay. Okay, so it's all right. I have written down some questions that you guys have filled in your form. I'll answer, and if still some questions are missed, I'm happy to answer them on the live straight away. So be with me. This is gonna be a sharp, crisp live session, just for around 30 to 40 minutes in total. So let's not waste some time and go through your questions. So somebody has asked, is it advisable to do MD in India and then come to Australia on specialist pathway, or what should we do? So if you are in your right mind, don't waste your time doing MD from India, because in MD during your MD in India, you'll learn a lot of clinical things and lots of bulk, seeing patients in bulk and developing that clinical judgment. But medicine in Australia is totally different. It's more advanced, and like how precise you can be. So if you're doing MD in India, going for 3 years of MD, maybe 1 year of drop to get into MD, then while you'll be coming to Australia with 3 years of consultant experience, it's already 8 to 9 years of time that you have wasted before you come to Australia, even as a specialist. And once you come here, the medicine you practiced in India will not be used here, because now you'll have to learn a lot of new things here in Australia. So I won't advise it. Yes, if you are doing MD, then going for AMC pathway would be advisable, because now all this experience can get you a better job opportunities in Australia even after AMC1. So if you are getting PG right now, join it and pass AMC1 meanwhile and move as soon as possible. If you are an intern, this is the best time you can come here. But if you are doing PG, clear AMC1, come here. Don't wait for your specialist degree to be finished and then coming here, because that's gonna take a long time, and even then there is not any surety. Okay, some people ask about observership. Should we join observership in Australia or not? If you are talking about observership for job perspective, that somebody will hire you as an RMO, GHO once you are doing observership, that's a myth. Most of the hospitals charge you to give you observership post. You are paying them to come here. You are paying for your flights. You are paying for your food. You are paying for your stay, and you are paying for all these 6 months to just observe and be there in Australian healthcare system. And even after that, they'll be like, sorry, we can't offer you job because you don't have a recency, or you don't have that experience, or you don't have research. So if you put those 3 to 6 months in your CV, do some research, maybe you'll be getting a job directly. So don't waste your money and your time in your observership. I've seen many observers coming to my hospital and then going back to India because they couldn't get a job directly. So right now focus on your AMC1, AMC2 exams and your CV, and there in no time you will get a job here in Australia. FMG and internship. Okay, this is an interesting question because I think there are many FMGs in this live. So if you are an FMG, please send a thumbs up and I'll see if this question needs to be addressed or not. Yes, next I'll be coming for the medical students who are in final year. But first, say if you are a FMG or no. Yep, FMGs, thumbs up, please. Wonderful, wonderful. So, if you are an FMG, there are two options for you. First, you clear FMG exam and start your internship, and during your internship, clear AMC1 exam and move here to Australia. The second option is if you are bit, unlucky to pass FMG exam, and now you will have to drop. Don't waste your time. Straight away go for AMC1 and come here as an intern. Although I agree that intern positions are a bit competitive to get, but these are not impossible. Even recently, many of my junior and friends came here as an intern. So it's difficult, but you just have to apply and it will be clear. Sujal, it in no time before you clear your FMG exam, you will be coming to Australia hopefully. So if you are hardworking and passionate about Australia, clear AMC1 now. Even without FMG, you can come here. Okay. Now, next question. Okay, let's just talk about final year students. So yes, if you are a final year student, I would advise there are two options. First, if you are having your exams anytime soon and you have a probability of failing your final year exams, don't prepare for AMC1 right now. But if you have a good repo, you'll be passing and you have plenty of time for your final year exams, don't start AMC preparation just 1 or 2 months before your final year exams. No, if you have 6 months or 8 months before your final year, right now you can prepare, you can join the course or start preparing your own notes, and in 3 months concise your notes. After that, focus on your final year exam and pass it. And during your internship, in 1 to 2 months, take the AMC1 exam, because many of my students who have cleared the AMC1 exam in their internship right now taking the AMC2 exam, and by the time they'll be finishing their internship, they'll be having AMC1, AMC2, and they can straight away come here as a JHO and start their medical career, MD in medicine next year. So if you are lucky enough, you are hardworking enough, come here as soon as possible. Okay. Many FMG students got rejected degree translation. Please tell how to fix this problem. Degree translation, I'm not sure how to do. If somebody knows who has got their degrees translated, please help Swift Motivation. How to translate your FMG degree? Can somebody help him? Okay. Yes, we can take the AMC exam during your internship, provided you have a degree or your transcript. So all the FMGs have their degrees with them. If you're an Indian graduate, then you can get the transcript for your degree from your college and you can verify it and apply for the AMC1 exam. Yes, even AMC2 can be taken during your internship. So no hard and fast rules. No, during your internship you can take both the exams. You don't have to complete internship. Okay. And now many of you ask about WBA. So what's WBA? And work based assessment. So when does it come handy? When you clear AMC 1 and with your good luck and with your good CV, good research with us, and you came here as a doctor, and now you are too tired, you are too lazy to clear AMC 2 exam, then you apply for WBA program. WBA program is nothing, just a 1 year of program when you are working in the hospital, and during that period you'll have to go to different consultants. You have a complete roster for you, like in January month go to this and this consultant, in February this and this, only 2 to 3 consultants, just 10 minutes of assessment. You'll be like, okay, I have to do history taking with this consultant in this month, so just 10 minutes of history taking, maybe 10 minutes of case discussion, and most of them pass. So in 1 year you don't have you'll pass your WBA and you don't have to sit into any exam. And once you clear your WBA, apply for general registration, apply for medicine training, and there is 100% selection rate. If you are applying for MD medicine in Australia, that is BPT, basic physician training, 100% selection rate, and you will be starting your medicine training straight away. And in 2 years time you can clear your exams, and during your third year of medicine training you can build your CV for your advanced training. But no exams after that, just one time exams during your MD, that is BPT, basic physician training. During your second year or third year, whenever you're comfortable, you can take that exam. So that's the exam situation. Okay, somebody was asking question with red hand. Sujal, sir, how to start medicine means how to study it, and also tell sir how to start study for MC. Sujal, I'm telling you, first of all, if you are a medical student or intern or post intern, you just have to focus on some crisp concise notes. You'll have to make those notes. There are two options. You can go with self study, go for previous year questions, recalls, MCQs, prepare your own notes in 3 to 4 months of time, and then 1 to 2 months revise those questions, practice recalls, and pass the MC1 exam. But the problem with that method is you'll have to go to different guidelines, different resources, and different guidelines, different resources have different answers to same questions, so it will be much confusing. The other simple option is contact our managers Nidhi and Samir. Nidhi, Samir, share your number please, and they will help you with the enrolling our course. And yeah, it will be easy for you, for us, and to be proud that our students are clearing AMC 1 and coming to Australia. So my Intel Health is a new change that they have made to verify your degrees. It's nothing but just Epic ECFMG verification. Okay, internship. Okay, Datya has asked. Aditya must be, it shows like Datya. Sorry, Aditya. I have done recently completed my internship in May 25. Clinical experience mandatory for AMC or getting a job in Australia? No. You just have to clear AMC 1 and English exam, and they love fresh graduates or the graduates with some good medical experience. For example, medicine trained. So you have a good luck, and if you prepare well, pass AMC exams, start applying for jobs, and in no time you will be coming to Australia. After AMC 2 or WA, so once you get your general registration in Australia that needs AMC 2 or WBA and 1 year of work, so after 1 year you can directly get into medicine training. So it's just a matter of 1 year. So Mandar has asked, she's an MD doctor doing training in dermatology. So yes, you can get a job. The only issue is dermatology is quite competitive. You have to go for medicine training and then 3 years of dermatology training to become a consultant in dermatology. But the beauty of dermatology is highly paid, very well paid branch here. So if you have a good background in dermatology as you are training, and in 1 year you will be coming to Australia, or 2 years, by that time you will be almost done with your training. So that part will look very good in your CV, and you can easily get into advanced training in dermatology and become a dermatologist in here. Okay, so now I'll ask I'll answer 2-3 questions from the form again, and then I'll answer your questions. Keep writing, and I'll see these questions in 2-3 minutes. Okay. Yes, somebody asked about my course, that am I taking the classes? Yes, I'm taking the classes, like 4 to 5 sessions during the course, and with me, Arushi and other mentors, we have like 9-10 mentors who are almost all of them are specialists from India. All of them have cleared AMC exam, and most of them are working in Australia right now. So they are more familiar with the system. And all my mentors, I'm really proud to say that they are really good at teaching, even better than me. Some of them are equal to me. So we have a best team, I would say, and it's such an affordable course. And taking the classes, I'm also hosting the orientation sessions, morale boosting sessions, teaching you how to prepare once the course is finished, how to utilize our course. So we are doing our best to make sure that our students clear the CMC1 exam in their first attempt, and we are doing everything heads over heels. And if you want to read our reviews, go to DRG Coaching in Google. We have recently made our business profile, DRG Coaching, and you'll find all the reviews that my students have given. So I'm proud to read those reviews. So yep. Okay, about research. So somebody asked about research, how to do it. It's such a time consuming process. So right now we are doing this research thing with one of my mentor, and my team is helping my students to publish their own papers. We have already published 3 papers with 15 of our students who wanted to do research from different states, different countries. We have come together to publish papers in good international journals, and without wasting much time and resources. So if you are interested, get in touch with my team, Nidhi and Samir. I'll be sharing their numbers in the description of this live if I can. Otherwise, even in my YouTube, Instagram, everywhere their numbers, even on my website, drguptamd.in, you can find the numbers and contact them, bug them. They are awake. It's just 5:30 in India, so shouldn't be a problem giving them a call right now. So, completed MBBS on RPGMC, and remember that you look a neuro case. Oh, thank you, Aditya. Sorry, man, I can't see your face here, but I'm your senior, it seems. So, special hello to you. Okay, so who is asking the next question? What is the career path after securing a RMO job in Australia? How do you get into specialist training? Wonderful question, Mohammed. Right now, my editor just sent me a video of this whole process. It's a 4-minute long video I'm gonna upload tonight. That what's your career progression here? What's the time frame? The day you join here, in how many years you're gonna be consultant? What's the whole process? So Mohammed, thank you for asking this question. I've already made this video and I'm gonna upload it today. So stay tuned. Okay. Gitansh, sorry, let me see Gitansh's question. I think I missed it. Gitansh, sir, is lonely? No. He's not lonely at all. Gitansh, you have lots of friends, not only Indian. There are so many international doctors, including Pakistan, Bangladesh, Sri Lanka, India, Nepal, China, Philippines. There are very few Australians who will be working with you in your hospital. But yeah, all of them, including the Australian consultants, are really nice, especially the Australian consultant, because their work culture is like totally different. They'll be so friendly, so nice to you, and they'll be trying to always push you to do better in your life. So I have worked in India for more than 10 years. My consultants and my colleagues were very good. Some of my consultants were like family to me. After coming here, I have seen that consultant being consultant but still supportive, without being family, without being friend, without being enemy. They are neutral, but when you need something from them, need any guidance, they'll be head over heels to help you out. So it's a beautiful thing about Australia that I have experienced so far. You should also experience this, I would say. I must say. Okay, so Dr. B has asked about the couple doctor thing, that if me and my partner who are planning to come to Australia, can we work together like me and Arushi are doing right now? So my answer to that is no, because during your first job, the beggars can't be choosers, because the first job is always difficult. So either one of you, if you get a job, grab the opportunity and come here. If you are married, your partner will be coming with you, and once you are into the system, you can always recommend your wife or husband, and they can work with you in the same hospital, because now you are their recommendation, you are giving the recommendations to your department, and your repo is something they can rely on. So even if you are getting first jobs in different hospitals, grab the opportunity, can get the job. Once you get the job, you come to Australia, you can always apply for change in circumstances, that the thing that now the circumstances are different and I want to migrate to another hospital, like with my husband or my partner, and they are more than happy to do that. Same thing happened with me and Arushi. So Arushi did change in circumstances and she moved into my hospital, and we are working together for last 1 year without fighting. Okay. Okay, so I did my MD psychiatry in India. What are my ways to get into a... Okay, Chinna has done MD psychiatry. If you talk about psychiatry in Australia, it is very well paid, more than medicine. And the life is so good. The only thing is, if you have done psychiatry in India and you are working as a consultant for many years, then you can come as a specialist here. You can try coming here as a specialist, but if you want to come directly here, getting into training will be easier, much easier. You can pass it, and in 5 years you will be a consultant, maybe less than 5 because you have prior learning as well. But once you're a consultant, you're a specialist consultant in psychiatry, life will be beautiful. So even myself was thinking of getting into psychiatry, because if I want to retrain, but medicine is medicine, man. But psychiatry pays really well. Then, will this work same for BPT as well? Sorry, I missed your previous question, but okay. Now I'll answer something from the questions you guys have already asked. Okay, research I have talked about. Specialist pathway, I think I have already talked about. If somebody who has done their specialization or they are doing MD, they have any question, they can ask. Yeah, most of you guys ask about the expense and whether we will be able to survive here. So I'll not say anything. I'll just simply say I have seen interns who have come here with their family, like wife and kid, and with the intern salary, they're surviving really well. They're living in a good place. They're eating well. They're enjoying all the festive things around. They're living luxurious life. So the money is never an issue once you come to Australia, and from day one you are getting paid. Even if you are getting trained, even if they are teaching you how to wash your hands, how to put a cannula, you are getting paid for that. And even if you are doing medicine training or any training, you are getting paid. You don't have to pay them. So don't think about money is eventually gonna come from the day you come to Australia. So don't think it like that. Okay. Okay, so many of you are asking about MS. If you have interest in surgery, just think it like this. Surgery is difficult in these countries, but it is not impossible, because interventional branches, they want to see how good you are, how dedicated you are. So if you really want to do surgery, ortho, or any branches like that, come here, start working, make your CV around these branches, and in 2 to 3 years you can get into these branches, especially if you have some experience from India or your home country. So don't think it's impossible. It's difficult, just like medicine is difficult in India, surgery is difficult in Australia, but the money part is really good. Even as a registrar and as a consultant, huge. So yes, you can become a surgeon here. Okay. Efficient timeline for a third year MBBS student who wishes to enter the Australian health system after internship. Okay, Mohammed, for medical students, I have posted a very good video in past. It's just like 5-6 minute long video. Please watch that. It's specially made for medical students, how and where to prepare. And I haven't mentioned anything about my course there. So it's just about self study and how to do the things. Okay, I can see some questions that I have already written here about anti-immigration rallies and racism. See, there were some rallies in different parts of Australia, and there are different rallies in UK, US. There are different countries having these rallies, but I haven't seen any racism towards me so far. All the people, including Australian, Aboriginal, everybody's so patient and so lovely, and they never treat you differently. They love Indian doctors, and I have a very good rapport with my patients and my colleagues. Most of the nursing staff is from Australia, and they are wonderful, and they are very good friend of mine. So I don't see any point of asking this question about racism. Yes, when you are in India and thinking of Australia and you see these news of immigration, anti-immigration rallies, everybody gets scared. Definitely you should be, because you're moving to a different country, you should be concerned about it. But yes, these rallies were organized by some groups who were asking their questions about the immigration thing, that how you're gonna sort it out. Many students from different countries coming to Australia, getting PRs, and but many Australian groups were in favor of immigration, saying that who will do these things. My GP is an Indian doctor; sees me very well. So there are mixed reactions to the immigration, but it hasn't touched any of me. It hasn't touched me or any of my friends. No news. So no news is good news. Don't worry about these rallies, and everything is settled. No, Prabdeep, no racism towards Sikh doctors. Even one of the doctor who came from UK is Sikh. He recently joined, and fortunately, he was one of my followers, and he recognized me in my hospital, and he was so happy, and it made me really happy to see somebody who knows me joining my own hospital. So that's wonderful. No, nobody has to cut their beard. Even Australian doctors have big beards here. Okay. I think I'm tired now. Is there any questions still going on? Any more questions? Please ask very simple questions now. I'm tired. It's almost 10:15, quarter past 10. Can somebody help Swift motivation about this degree translation thing? He's paying $600 for this and getting rejected. I don't know how the things are gonna work. I think it's done in Delhi. So if somebody has gone through this thing, please help him. Okay. USMLE versus AMC is a huge topic. I have already posted a video. Watch this very detailed video. So please watch it. Yes, couple doctor thing I have already explained. You can get the same hospital, but once you have to get a first job in Australia, and then you can migrate and transfer. Alone initially without a spouse and family, they get very isolating. Peace is totally up to you. If you are friendly in India or your home country, you'll make lots of friends in Australia as well. But if your nature is like you want to live alone, then it's totally your choice. But I don't see there are doctors coming from all over the world, and they are here to make friends, to support each other, and the bond here is so strong because everybody is a migrant. Most of the doctors, like more than 30%, I think, are international doctors, and they help each other. So okay, so what about PG branch fees in Australia after male radiology term? Buddy, there is no fees in PG. I'm again saying you don't have to pay them. You are getting paid per hour. You'll be getting paid around $70 per hour in your regular hours, and $140 per hour when you're doing overtime, so you don't have to pay. Okay. Okay, so what I'm gonna do is, give me a second. So what I'm gonna do is, right now I'll finish this live because it's more than 40 minutes now. And if I still miss your questions, please ask in the comment box. It will give me some reach, it will give me some topics to make video on. So feel free to comment on this live video and I'll see if I can post it or not. But yes, I would like contact on these numbers and they will help you. I'm also gonna comment on this, how I can comment on my mobile phone. Okay, I can. Hmm. Okay, in Australia, your PG degree will be considered experience and not PG training. Yes, unless you are a consultant in India. So, how do I comment here? Uh, okay, so everyone, I don't know how to. Mm, give me a second. 80. Sorry. Just note down this number. If you want to ask me any questions, you can contact these people. 78076755369. Okay, so this is 8076755369. So contact this number and feel free to ask your questions, and see you next time. Thank you everyone for joining, and I hope it was useful. Thank you. Okay.